review of the peer-reviewed literature, including PubMed and OVID. We basically look for LASIK, laser vision correction, and laser in situ keratoconiosis. We have over 2,900 abstracts reviewed. We evaluated almost 1,600 articles, and out of those 16 articles, we have 309 articles that were included into our database. This was a worldwide review. We have articles that were not in English, including German, Russian, Chinese, French, Hungarian, that they were translated, and then the remainder of the articles were in English. These articles were classified according of the strength of evidence in level 1, level 2, and level 3. So additionally, we did another review from March 2008 to May 2009 to include what was published in that additional year. We found 365 abstracts. Out of those, 14 articles were reviewed, and none of them were added to the original database because none of them qualified to be included. And here is the distribution in the different peer-reviewed journals. The location of the study, they were located in Africa, Asia, Australia, Europe, Latin America, North America, you name it, and everything were included. So now, out of those 309 articles that we have in our database, just 23 articles reported on nighttime vision symptoms. And nighttime vision symptoms being glare, halos, both of them, difficulty driving at night. These articles that focus on this, 43.3% of these patients complain of some sort of nighttime vision symptoms pre-LASIK. But just 23.5% of these patients complain of nighttime vision symptoms after the surgery. Now, there were two articles that actually reported if the glare symptoms were worse, the same, or better after the surgery. And you can see here that more than 75% remain unchanged or better, and just 23.5% of the patients complain of these symptoms of glare being worse after the LASIK surgery. Now, when we evaluated just the refractive error, we found that myopes tend to complain a little bit more than hyperopes. And the follow-up time is also important. Those patients or studies that were evaluating these patients 1, 3, or 6 months after the LASIK surgery had more complaints of nighttime vision symptoms compared to those studies that were followed up longer than 6 months. Other facts is, one of the issues that we faced when we were doing this review is that some of the articles reported in number of subjects, and some of the articles reported in number of eyes. So the number that I have presented to you before were based on the number of subjects. None of the studies that reported in subjects did any surgeries using wavefront-guided systems. However, in one of the studies that reported in eyes, they used myopic customized occlusion. We said that based on our review, either the nighttime vision symptom improved or remained the same in more than 75%, that myopic wavefront-guided techniques induce less or seem to induce less nighttime vision symptoms than conventional treatments. Myopic patients tend to complain more than hyperopic patients, and patients with less than 6 months follow-up will complain more of these. However, we also compared these nighttime vision articles that also reported in patient satisfaction, and we saw that there was a high patient satisfaction regardless of the nighttime vision symptoms.